Bev Muendel-Atherstone, who is a chartered or registered psychologist, very concerned about healthcare, was one of the driving forces behind the work on the cytology lab, will now say a few words.
Thank you. I'm not as young as Michelle, so I don't know how much I can shout. I'm a psychologist. I have nothing to do with the healthcare system. In other words, I'm not employed by a hospital, Alberta Mental Health, or anything else. I work in the schools. But as a psychologist, I have to say that I was working as a counselor during the time when the nurses were being bumped. And one nurse after the next would come in to see me and say, I'm under so much stress. Oh dear. Woo! I'm under so much stress because I don't know if my job's going to be bumped or if I have to bump someone else to have a better job. And this was putting the nurses under terrible stress. This was about 7 years ago. And they came in and they said, you know, the nurses who are fired or who quit are actually in better shape than those who have to stay because the stress is too much.
Bev,
and as
the microphone works now.
Microphone's working.
Hello. Hello, test.
Just you go ahead and I'll
I hope we're not going to blast you now. How about the people in the back? Raise your hand. Can you hear me? Okay, great. All right, so I was talking about the nurses whose positions were being bumped and nurses were losing their jobs. And what happened is that the nurses who were left working in the healthcare system were doing the jobs of 2 to 3 nurses. And they were being hired back on to work on the weekends or work extra shifts. And they were getting exhausted. So exhaustion on top of stress, you can imagine what was happening. The possibility of more mistakes being made was greater. Anyway, so now we're going to have music. Okay, so the reason I want to talk to you people is because stress is the big killer. We know that if we are stressed in any factor of our life, it's going to shorten our life. We're going to end up with illnesses. We're not going to sleep we're not going to sleep well. We'll be tired during the day. We know that being tired can lead to all kinds of accidents at work and accidents on the highway. So stress is the big issue. When we have a super board, when we have a government in place that is creating so much unease in the system that we don't know what's happening from one day to the next, we are stressed. We have no idea if we go to the hospital whether there will be doctors or nurses there the next day or not. We don't even know if there'll be a hospital there. Perhaps they'll decide to bomb it. Perhaps they'll decide to sell it. We've seen this in Calgary and Edmonton. So we have no idea what's happening, and this creates an underlying level of stress in all of our lives. Now, with the long-term care situation, where we've heard that 7,000 long-term beds are going to be taken away in the next 4 years, and I can see many of us are thinking, oh, in another decade or 2, or even shortly, we'll be looking at some facility like that. We do not know what's happening, and this creates stress in our lives, and it creates a downloading onto our families, not knowing what to do with our aging and sick relatives, parents. This creates a downloading of a lot of work. And I'm sure a lot of you have seen this. A young mother goes to the hospital to give birth. In times past, you would be in the hospital for a few days. 3, 5, even 7 days after cesarean section. I had 3 cesarean sections, you know, I would be in the hospital for about a week and then go home when I had adequately recovered. Now, overnight, you're home. You're home the next day. And who's taking care of you? Your family. What does this do? Creates more stress. So our whole system is downloading more and more onto individuals in society, to you and me, your family and friends, so that someone at the top can be making the money and we are having more stressful lives. So as a psychologist, this is what I have to say.